Many ladies feel a lump in their breast and immediately fear the worst. Today, I want us to go through what really means to have a surgery because of a breast lump, and also to know what is a breast lump, how to prepare for the surgery, and how to take control of your health with clarity and not fear. I'm Dr. Joshua Derito, a family physician. I have interest in public health and cancer prevention and treatment. So in this video, we are looking at surgical management of breast lumps and what to expect. Do not panic, but it is easier. It is necessary to take control and also to prepare. So she found a lump in her breast, and she felt her life has changed completely. So what are breast lumps? So these are growths that you find, and a lady can feel them, or even men, when you feel you are blessed. And this could be something either just benign. Benign means it is something that is not life-threatening. It's not something that grows. It is not something that will spread. It is benign. Then there are those that are malignant. Malignant means it can spread from the breast to other tissues. So when you find a lump in your breast, this could be life-threatening, or it could be just something that is just passing. And sometimes you need to have it looked by a surgeon, and then he has to decide, is it necessary to remove this lump, or we just leave it. And you'll find that many of the lumps that are found in the breast, they are not cancerous at all, and they might not even need attention. But sometimes a surgeon might decide that we need to remove it, and we need also to biopsy it. So many times that a lump is found in your breast, then you may need to have what we call a core biopsy. A core biopsy is when a needle is put into the lump, a part of the tissue is taken from the breast, and then it is looked in a microscope. And depending on the cell types that they will be seen on the microscope, you can be able to tell what is a benign or a cancerous lump. So many of them, as I've said, are benign, they are not growing. And many of them actually could just be growth of the fat tissue of the breast, and they do not need anything beyond that. So as I said, not every lump needs surgery, but you may need to have the lump removed. Surgery is usually done to remove and analyze a suspicious lump, but before it is removed, it is usually good to have it biopsied. You can be done what we call an excision of biopsy, where the whole lump is removed. You can have the lump removed, what is called lumpectomy, or you can have what is called mastectomy. The whole breast is removed. So often surgery is recommended, what I've talked, either biopsy or lumpectomy or mastectomy, when the imaging is inconclusive. So you have done an ultrasound, a lump is found, it is not very clear what it is, then you may need to have it removed. The lump is growing or increasing in size, you may need to have it removed. Then if the core biopsy, what I've said, a needle is put into it and it suggests an abnormality, then you need to have the lump removed. So surgery is often part of the diagnosis. It is not just for the treatment. and gives the doctors a clear answer, which would also help you get peace of mind when you know what exactly that you have. So what are the types of surgery that can be done to your breast? Then let's look at the excisional biopsy. This remove the lump in total to examine it. You may have a lumpectomy. It removes the swelling with a part of the margin of your breast. And then there is mastectomy, which removes the whole breast. So this usually vary depending on what the surgeon feels is the likely cause of the lump, and most times the procedures are simple and they are done to protect you. As I've said, the first operation on any lump in the breast is to do what we call a core biopsy, where a needle is put, tissue is removed from the breast, and then further treatment is decided by this core biopsy. And I've said what are the indications for the surgeries. If the core biopsy is inconclusive, or sometimes some lumps can just be removed for them not to be a nuisance. Sometimes it's something we call a fibroadenoma, which is a lumpy swelling, which is well defined. It moves around the breast, that is non-cancerous, but it's usually a nuisance. It can grow in size and makes the breast feel bulky. And sometimes some of these lumps can be removed to avoid confusion, because you may not know what is the fibroadenoma and when other abnormal tissues are developing, and this could be cause confusion. So what some of the things that you need to know before you have your lump removed? It is important that you have physical exam and also imaging. You may have an ultrasound or a mammograph or an MRI, depending on what your medical provider thinks is necessary. Then you may have some blood work, and you may need to have the anesthesiologist see you before the surgery. Then there could be some necessity for you to fast before the night of the surgery, and then you may need emotional support when you are going through the surgery, and you may need to discuss with your surgeon. Not you may need, but you need always to discuss with your surgeon what is going to be done, why is it being done, and what do you expect after the surgery. If the lump is being removed for diagnosis, how long will it take before you get the results? So it is important to prepare physically, but also prepare emotionally. You are not alone. Your surgeon is with you. And if you have any question, feel free to ask. You need to understand every step of the process, and it is your right. So what happens during the surgery? You may be put to sleep, or you may just need to have local anesthesia around the breast tissue. Usually this is done as a daycare procedure, so you can go home the same day, and then it can be performed, as I said, at a local anesthesia in the breast, or you can be put under the sleep, especially if they're doing a mastectomy, that is removing the whole breast. That will be done under general anesthesia. If they are just removing part of the lump, then that could determine whether you need to be put under the general anesthesia or local anesthesia. It depends on what the surgeon and the anesthetic team feel is necessary for you. Then the surgery lasts between 30 minutes to 90 minutes, depending on the type. And then after the tissue is removed, the pathologists are people who look at tissues in the laboratory and determine, is this normal tissue, is this abnormal tissue? If it's abnormal tissue, is it cancerous, or is just tissue that is just a nuisance that is giving you sleepless nights for no reason? So remember that a skilled team is at your side. The lump will be sent to the lab, and then you'll be given the answers. Possibly you may have to wait. Usually most of the times you wait for about between 5 and 10 days. But if the lump is deemed to be cancerous, then your results might need to be fast-tracked so that you get the results the soonest possible. So after the surgery, your healing begins. So you have the recovery, you have the results, and you know what then after this. So you may have some mild pain, you may have some swelling a bit for a few days, and then you may need to have your dressing changed after about 2 days, and then you may need to be seen by your surgeon 1 to 2 weeks after the surgery. Then the results will be out of the pathology in 3 to 7 days, and then the plan of what will happen will be determined by the result, either monitoring, further treatment, or just the assurance that your lump was benign and you do not have any complications. Most of the times the recovery period is smooth and the result waiting might feel long, but remember that these results will bring clarity and courage and also healing and guide your team on what needs to be done after this. So what if it is cancer? Your team is there for you. So you are stronger than you think, and the team, your team will be there for you. So if it is cancer, you have caught it early, then there will be surgery, and then possibly the other treatment will follow. You have treatment options and what should happen, and you are not alone. Remember that your team is there, and they care and they will work with you. So remember that if it is yes for cancer, then remember that early action will save you long-term pains, and it will save your lives. And then the treatment option will be given to you. And when it is cancer, then what will follow is what we call the staging. Staging is determining what is the extent of your cancer, what tissues are involved. So you may need a CT scan of your chest, a CT scan of your abdomen, a CT scan of your brain to know how far the cancer has gone. So remember that not all breast lumps are cancerous. Surgery is often for diagnosis, and it is safe. It brings early diagnosis, and also it can give you peace of mind when you know what to do next. Ask any question that you might have, seek support, and trust your team. Always when you are going for these operations, have a support person who will be with you through the process, and will also be there with you when you get the results. So do not panic, do not delay. You have the power to take control of your health. Surgery is not the enemy, it is the gateway to getting answers. So remember that if you have a lump in your breast, do not wait, do not get scared. Getting to fear is normal, but discuss this with someone who is trusted, and discuss it with your health provider, who will be able to tell you what to do next. So see a doctor, get the necessary imaging and the necessary blood test. Do not ignore your intuition. If you feel something is not right, get the necessary assistance. 1 in 8 women will face this journey. So, but the sooner you start, the better the chances for better outcomes. I ask you that if you have liked this message, share it with someone you love. You might save your life. And if you have undergone any of these procedures, share your experiences with our viewers so that they may also have an idea what happens, and they will have first-hand information. Thank you for watching. We meet in the next video.